Western Spring Television. Ours it is.
Yes, good afternoon, viewers at home. You're welcome to your favorite program, Spring Clinic. This is a platform where we discuss all the health concerns of our people, and we attempt to take it from the very sophisticated professional angle to simple discussions where our people can benefit. A lot of us may know that we should go to the hospital, but we are not guided enough. The burden of this program is such that we are educated, we know about some of our health concerns, and all of them, not even some, all. Right from the point of the caregivers, that is the professional caregivers, and even those that are also at the receiving end. And this is what we are doing on this Spring Clinic, a program on Western Spring Television, channels 190, start time. You're welcome. I have the privilege of discussing a very important topic this afternoon, which is the health concerns of women. We know that there's a popular saying that says that the hand that rocks the cradle rules the world. Women are so crucial, so important part of the society, part of our lives, that their health is of paramount importance. When anything goes wrong with the health of women, the family collapses, the society collapses. And that's how serious the discussion today is. We're going to look at a kind of a panoramic view of the concerns of health, the health concerns of women today. And I have the privilege of bringing somebody who is deeply experienced in the care of women. He's a consultant obstetrician and gynecologist. He works at UniOsun Teaching Hospital, the gynecologist stroke obstetrics unit of the teaching hospital. I have the privilege of bringing on Dr. Oluseyi Atoda. You're welcome, sir.
Thank you very much, sir.
It's a pleasure bringing you on this program.
My pleasure to be here.
We're going to have a very wonderful time here today because I don't think it's a topic we can exhaust just in a few minutes. Women, most people want to look at them as weaker vessel. And some people erroneously think, or don't let me say erroneously, they think that women, what's your own opinion about this popular saying about women being weak?
Well, I think the issue of women being weaker vessels may be a defensive statement, probably from the men folk, to try and defend ourselves from the so many other colleagues that go with a woman. Let's start with, we have never found anybody say behind a successful woman is a successful man.
Absolutely.
They say behind every successful man, there's a woman behind him. So that woman is not likely to be a weak vessel.
And they even say that the hand that rocks the cradle rules the world.
Yeah. Then we never said Father Africa. We said Mother Africa. We can just keep going on. And you know, earlier on when you talked about when a woman is not there, and I remember something came to my mind that I came up with some time ago, that somebody said, I can't remember the name of the poet now, he said, women are like the salt. Their presence is never felt, but the absence. And you remember, which is true.
That's true, sir.
When you eat food in your homes, nobody remembers to say, oh, Effie, your sorbet.
That's correct. If the salt is already there.
But just try it one day, that they serve you food without
it's
salt.
It's like your wife traveling for a week.
Exactly.
And you have to take care of the children.
Yeah.
As one is trying to jump from the table, the other one is actually trying to light the gas that he does not know, or is running, wants to run out. And then you wonder.
And you're supposed to prepare them for school. And you also don't want to be late for work, that for them to catch the bus and you also get to work. And these women do all these things every day.
You know,
she's the gate man.
Yes.
She's the timekeeper. She's the housekeeper. She's your alarm clock.
Absolutely. She's your financial expert. Apparently, from our own field, we found out that the brain of a woman, you know, we have two hemispheres. It's been established by science that the two hemispheres of the women keep working at the same time.
Yes.
That's why they can multitask.
Yes.
The men, it is just one of the hemispheres.
Exactly.
So I think they must be quite powerful.
I agree too.
There should be some form of consequences to this enormous strength, enormous task. What do you think are some of the challenges they can face medically as a consequence of this enormous?
If you look at it from a broader perspective before quoting that, I think part of these challenges and all what they go through, that is why if we go in terms of lifespan, that you discover that most times the women are likely to have a shorter life expectancy rather than the man. It could be.
Although men argue that. Men argue that women outlast them.
Well, men argue that quite all right.
I think so. But I think beyond that too, the hormonal profile in itself takes them into a roller coaster almost every 4 weeks.
I think to remind us also, those who say women outlast them is usually based on men who have actually probably married a woman 7-10 years younger than he is. So what does he expect?
Oh, okay.
But if you marry a woman that is likely your age, you are likely going to go before her.
So most likely it's a strategy maybe men adopt so that
to make sure that
they can have some measure of control. Yeah. So so women, what are these common problems from your own experience that you think they come up with?
Yeah, I think because we are saying health concerns of women, but we should even have said that health concerns starting from the female, right from childhood to adolescence to being that young woman, the middle-aged, the elderly woman. There are concerns associated with every aspect of their life, being
a woman.
A woman.
So let's start from being an adolescent. What are some of the challenges?
From being an adolescent, the greatest challenge you could have is the onset of menses when she achieves menarche.
That could be traumatic?
Yeah,
that could be troublesome?
It could be troublesome, it could be traumatic if she has not been psychologically prepared. And we live in a society whereby we shy away from discussing some of these intimate things with our children.
Especially our girls.
Yes, our girls.
Yeah.
So a girl who is in school and has not had anything like this before, she starts bleeding.
When actually, she gets stained.
So that can really be traumatic.
Absolutely.
For her.
I also heard that from our own field, I'm a psychiatrist.
Yeah.
Some of them could actually have some behavioral changes that we, as forced us as psychiatrists, to even classify as premenstrual syndrome.
Yes.
Where there is change in mood, abrupt change in moods.
Yes.
Unduly irritable, very anxious. Some of them will not sleep. Some of them may even have mood swings and all of that. Yeah, so apart from that, what are some of the other challenges?
So then when it comes to the issue of sexual exposure too, if the girl has not been opportuned to have been well counseled about this issue of you becoming pregnant, a woman, and they are now developing secondary sexual characteristics. That's also a challenge.
Absolutely.
You find some of them that when they start getting busty, she tries to compensate with postural differences. You find the woman, she's trying to walk like this, trying to hide her bust.
That's correct. And some who are not as blessed, can also have a lot of
some
psychiatric
of them
problems.
To start trying to walk like this,
beyond,
so that people
even beyond that, even beyond the postural thing, some of them can even have a lot of psychological problems.
Yes.
About the fact that they feel that what makes them a woman is not just there.
Not there.
And some can actually be depressed.
Yes.
And parents are not aware.
So those are just even physiological changes that have not even come to disease conditions.
Absolutely. In fact, some of them can actually dovetail into frank psychiatric disorders.
Yes.
Some people get depressed because of the way they look, a lot of dysmorphic features, syndromes, a lot of them depressed because they feel what makes them a woman is not there, depending on where they are growing. there's this syndrome, they call it anorexia nervosa. It's not very common here.
Yes.
But of course, I think our children are getting there, especially the females, where they want to look very
slim.
And when they think they're adding weight, they don't like themselves. And some can actually get so preoccupied.
Yeah.
Thank you, doctor. So what other things?
Yeah. So if we leave that, now when it now comes to the grown woman in the middle age of making babies, the challenge a woman can have is we already have that societal pressure on women, believing that once you get married now and everybody says, oh, this time next year, we're coming for your naming ceremony. So we have even already started with pressure on right on the day of marriage.
Yeah, because if the woman doesn't get pregnant in this part of the world, that I think is changing, maybe that's an area you need to let us know. It is the woman's fault, not the man's.
Yes.
She's not a productive woman.
Yes.
And at times I think men have been brought into family meetings where they said, where did you get this kind of a girl?
Yes.
Somebody can even say the day they saw her leg is so thin. Yes, and they already saw that this one cannot have children. That's why she doesn't have infertility.
Which is actually not the...
So what about this infertility and women?
So that's, in fact, that's a great challenge, which is even now on the increase. You know, the medical books used to say if you have been in marriage and you have slept with your husband regularly, average of 3 to 4 times a week for 1 year, that is when we declare it infertility. But nowadays, it's changing because now you even have women getting as old into their middle 30s before they start getting married. That's also a challenge because now everybody wants education.
Yes.
As to strike here and there, schools are not moving as fast as it used to be. So a woman finishes secondary school, tries a master's, wants a PhD, everything, she still wants to acquire it in her father's name. So by the time she's getting married, she's in her mid-30s.
So could that be contributory to some of this delayed?
Yes, because infertility is on the rise and age is associated with it. Then environmental changes, it's also affecting the quality of eggs of women. Polycystic ovarian syndrome is on the rise.
What is this polycystic?
Polycystic ovarian syndrome is a situation in layman whereby on a monthly basis, instead of a woman just to produce between 4 to 6 eggs baseline in her ovaries, she has close to about 10, 12 eggs. So 10, 12 eggs try to develop together every month. Confusion sets in and there's a halt. So the woman ends up not ovulating regularly. So you see such women, she does not have a monthly menses. Maybe one menses now, no menses for 3, 4 months, and some other things associated with it.
Yeah, what are the other factors again that we could see on the part of women that could be contributory to this infertility?
The other one that could be is, you know, nowadays we have lost some ideals of our culture. We have lost the family unit relationship is not there. So many ladies have had mistakes in their life, may have had early premarital sex, contracted sexually transmitted infections, not poorly treated, leads to other factors of infertility. So tubal blockage is also on the rise there, repeated infections. You know, we are now in a society whereby having, maybe we'll say it's westernization or civilization, women also having multiple relationships at the same time, sexual partners. So all those will still tell on the overall health of her in terms of infertility.
How about the men?
For the men
also, in terms of infertility, is it just the woman's factor?
No, you know, before now, the books used to say female factor was 40%, male factor 40%, then unexplained 20%. But I think now we think man is on the increase.
Are you serious?
In my fertility clinic, out of every 10 couple I see, at least 5 or 6 of them either have a low sperm count. And from that 5 or 6, 2 of them have 0 sperm count, azoospermia. I think that's more on the increase now compared with...
What do you think is responsible, although it's not a men's clinic here, but because it will help us to understand this concept of infertility. You know, traditionally or culturally, I don't know which one, but oftentimes we hold the woman responsible.
Yeah,
so what you are saying means that the table should be turned towards the men.
Well, I think it's just the men trying to take care of their ego. Because if not, if you go back into our history and statements made by our fathers, which we have tried to look back into some of those things, how did we come about the concept of Ileton Toru?
Meaning that there may be some form of
from inception
from the men.
From the man.
And then some people hired to...
Whether a cousin, a brother, or someone else entirely. Because I've always thought of it, why was that statement there?
And it's like an emphatic statement.
Yes.
Like almost every child, every family may have one or two.
Exactly.
Which is to cover up for the infertility factor of the man.
Of the man.
Not from the women.
Not from the women. So that means the man too has actually always been there. But then maybe they had ways of trying to
cover it.
To cover
of course,
it.
in a patriarchal society where the women's voices are not heard, and of course, everything happens because of the woman.
Yes.
Not the men.
Yes.
So we've had a way of wriggling out.
Yes.
And
even some of them then that they know, they have always found ways of probably getting a brother to do the job, and everybody keeps it as a family secret.
That's what can explain that statement.
Yeah.
You know, I never looked at it that way, but it always sheds light to
it actually had been there.
So what advice do you have for a lot of women that are actually undergoing this infertility? Because it seems to be common.
I think the advice will be if you are 35 years and above, 6 months into marriage, I think you should just see a gynecologist to be sure that all is well with you. 6 months into marriage.
How do they get the men? Because at times some of the men will not want to come.
That's why we all have a role to play to encourage men that it's no longer a woman's thing. Even if the woman has the issue, she needs the support of her husband. There's a lot of psychological trauma for a woman who is infertile. So she needs the support of the man to be able to protect her, care for her when she's naturally down psychologically, and to save her from societal pressure. You find such women, they try to coil back into their shell.
No, because they are stigmatized.
Yes, they don't attend social functions.
Because they'll be asking.
They don't attend family gatherings.
Yeah, because they'll be asking them. They won't ask the man, they ask the woman.
They ask the woman.
So oftentimes,
the only thing we ask the man is moto enko.
So somehow, I think a good number of the women recoil from social interactions.
Yes.
They take all the blame. But so viewers, what we are learning this afternoon is that when there's infertility, the factors are even rising for men being the cause of infertility.
Yes, certainly.
So which means that when this occurs, it's not the time to trade blames. It's not the time to say you are the one that is infertile, you are the one. Let's go for tests. Let doctors look at it as we pray. Because some even escape into religiosity, they don't even go for tests for several years.
And you know what I tell my patients when they say, oh, I've been on the mountain for this number of months, I've seen this, I've seen that. I said, but have you seen the doctor? So I'm just going. I said, but I've never seen a book that says pray and walk. What the books have said is walk and pray. So that means you have not done the walk and you are praying.
Wow, fantastic.
So yes, you must pray, but you must walk before you pray, so that the prayers can help us.
I hear of this illness, fibroid. What is it all about? I mean, it's very common, and it happens to a lot of good girls.
Yes.
Quote and unquote.
Well, you see, part of what we know from age long is any womb that refuses to carry a baby will carry a fibroid in layman's language. So nowadays that women are taking longer to get married, fibroid will be on the rise.
On the rise.
Unlike when our mothers got married at 21, 22
Even
years of
18,
age.
19.
And they still had education.
Absolutely, yes.
Then. My mother got married at 21 years of age. And by then she had her NC. And thereafter she proceeded with a degree program. But nowadays it's a changing thing.
It's like you're advising us that our women should get married quite early once they find somebody, once they find a good suitor.
Yeah, that may have been.
It could
but
be quite protective.
Yeah, it could be protective. But unfortunately, other societal concerns must come into play. The woman who is 21 that you're asking to get married to, the boyfriend may also be 21 years of age, a 300 level student.
Both of them being fed.
Yeah.
Being fed from home.
And you want them to start making babies. So things are actually changing.
Are changing.
They are changing
dynamics.
the other dynamics in the society,
socio-economic,
which we must also curtail with.
We must bring into
So
consideration.
every black man has a tendency to develop fibroid.
Yeah.
Every black woman.
What's the
Being
treatment?
black.
What can we do? Can it be managed?
Yeah, that's I think the one we should actually go with. Anybody who has fibroid should actually see a gynecologist. Coupled with the fact that if you have infertility issues along with it, so that they can professionally tell you if the fibroid has anything to do with your challenge of getting pregnant or not. Not every fibroid has to do with getting pregnant. But there are other concerns. If the fibroid is there and it's big enough that obviously shows that you are about 4 to 6 months pregnant or beyond, then you must do something about that.
There's no way a baby can coexist with that.
Yes. Even apart from that, it may be pressure on your kidneys, and you may also develop hypertension.
Yeah.
With that. Then if your fibroid is that is giving you prolonged menses, instead of having your 4 to 5 days and you are menstruating 8 days, 1 week, 17 days, there's a need to do something about that. Or you're having a heavy flow to the point that you could collapse during the menstrual cycle. That's blood loss. So fibroid is something
These are signals that
you
are pointing to the fact
you
that
must see a doctor.
Yeah.
Yes, I know we all have the fear of the knife. I don't want surgery, and people think, let's look for alternative care. But let me say that all the herbals that are out there, whether Western herbals, traditional herbals, and other alternative therapies, they may shrink the fibroid.
Okay.
But unfortunately, the fibroid still tends to grow back after some months or years.
When the hormones come again,
the fibroids tend to grow back. And also, I know somebody out there, if this was a phone-in program, would quickly say that, but they also say that when you remove the fibroid, there's a likelihood for it to grow back. Yes, I agree. That's how challenging fibroid is.
That's okay.
Because you may not have removed everything, and maybe some that are just like millet seedlings
and then
that
start growing up
will
again.
start growing. But surgery is still a better option.
Thank
and
you,
avoid caustic substances inserted in the vagina. That is not the right one.
Thank you.
Any herbal they give you that is other than you taking by mouth or probably rubbing on your abdomen if it works, but if it's for you to insert,
it can be more destructive.
Yes, we have seen women who end up having an adhesion in the vagina, whereby the vagina gets plastered together and cannot even admit a finger. Not to even talk of admitting
this is serious.
Something else. So
thank you, Doctor.
That can be an issue.
Dr. Atoda, we can see that viewers at home that is an interesting discourse going on here. A number of things that we have not seen. We're going on a short break. We will continue hitting this point by the time we come back. Don't go away, please.
The 1914 Amalgamation Treaty is synonymous to the birth of Nigeria. Frederick Lugard, a British Army captain and an outlaw who struck gold in Africa, became the instrument used by destiny to make it happen. The amalgamation of Nigeria was designed for economic reasons by the colonial administration to offset Northern Protectorate budget deficit by Southern Protectorate surplus returns. The amalgamation had ab initio created imbalance in the economic political structure of Nigeria and was responsible for the persistent hiccups and the efforts to forge a united country till today. Nigeria's amalgamation was labeled as the mistake of 1914 by native northern conservatives who neither wanted it nor contributed anything significant to its sustenance. Western Springer Television identifies with Amalgamation Treaty of 1914 as a watershed event in history. The British Empire was the largest and the most powerful in the world, At its zenith, the empire embraced a quarter of the earth's land surface and imposed her imperial majesty's rule on more than 458 million peoples across nations and continents. The empire took off with overseas possessions and trading posts established by England, spread over 3 million kilometers between 16th and early 18th century. Like previous empires, the British Empire began to crumble on its weight of overstretched territories and growing unrest in our various colonies. Today, the British Empire no longer exists. What is in place is the Commonwealth of Nations, a loose association of sovereign states which recognize the King of England as the titular head. Western Spring Television identifies the British Empire as a watershed empire in history. The Berlin Conference of 1884 defined the configuration of Africa, which hitherto existed as a continent of multiple kingdoms and empires under native rulers. The conference, otherwise referred to as Congo Conference, regulated European colonization and trade in Africa as initiated by German leader Otto von Bismarck. The Berlin Conference is often called the scramble for and partitioning of Africa, as each of the imperial powers carved separate portions of the continent for themselves without recourse to racial and cultural identities and differences. 137 years after the Berlin Conference was held, Africa remains a legitimized playground for European nations that sought to exploit its wealth and resources and manipulate its human capital to promote trades and investments of Western powers. Western Spring Television identifies Berlin Conference as a major event in history.
Viewers, you're welcome back to the program, Spring Clinic, where you have the opportunity to be educated on different kinds of our health concerns. I have with me today Dr. Oluseyi Atoda, consultant gynecologist, obstetrician with Uniosun Teaching Hospital, who has been discussing with me about the health concerns of women. Doctor, just before the short break, I wanted to ask, there's this belief that when women engage in contraceptive use, it can also be responsible for infertility. I don't know what's your statement or what do you have to say about this, sir?
Well, that's one of the myths of contraception. It is certainly a big no. No, it doesn't. Contraception does not predispose a woman to infertility. It has its benefits that cannot be taken away from it. It has side effects quite all right. Just like every other thing has side effects. Even taking water has side effects.
Absolutely.
Yes, you may have a heavy menses, which you must have been cancelled on before embarking on it, which usually does not last more than about 3 to 5 months, and your menses regulates back. And peradventure, one family planning technique does not work for you.
You can ask for
You
another.
can switch to another one. There are over 10 contraceptions.
So you don't have to be boxed into one and just keep enduring
and
the one that's giving you trouble.
Every family today needs family planning. It's not just a woman's thing. Family planning is a family thing, and it is about spacing your children and limiting the number of children.
So you're saying that some of us men can actually go for family planning?
Yes. Condom is a common one, but people don't really remember that condom is part of family
Especially
planning.
when they are with their wives.
Yeah.
And but vasectomy, I don't know how many men have ever done vasectomy.
Yeah. So, though they are still working on, there's work now to see if men can eventually have reversible contraceptions also.
Okay.
Maybe injections or tablets. There's ongoing work, maybe in the nearest future.
I think it's the irreversibility
of the vasectomy
that scares the men.
Of the vasectomy.
Let's go into a more scary part. You see this beautiful woman, accomplished woman, and they just hear, bam, there's cancer. Please, can you speak to us?
Yeah, that's
and what we can do.
Now that's one big challenge. That's one big challenge. And unfortunately for us, cancer is everywhere. It affects all age groups. It affects all sex. And when we narrow down to women, right from the 3-month-old baby to the 90-year-old woman can have a gynecological cancer. So it's not just about an age group. And every reproductive organ of the woman can be involved in cancer. Right from that you see on the outside, the vulva, to the vagina, to the cervix, the uterus itself, and the fallopian tubes. Any of them can be involved with cancer. But cancers have geographical predilections.
Absolutely.
Like here in our environment, we know what you have on the rise is cervical cancer and ovarian cancer are the two most common female reproductive cancers we have here. In some other societies like the Orientals, you have more of the vulvar cancer. In the Americas, you have more of endometrial cancer being on the rise. I'm not saying we don't have ovarian cancer here. It's here. We have endometrial cancer, but we know cervical cancer and ovarian cancer are the ones more on the rise. Unfortunately for us, almost all these cancers, there's nothing you can do about them except when it just appears, boom, on you.
It can be, there's no precaution?
Yes, there can be.
Can we take steps?
Yeah, we have said there are predisposing factors, there are risk factors, but you find women also who don't even have any of these risk factors and still end up developing them.
What can be done?
But the ovarian, when it comes to that, maybe I should just narrow down since you're on that. The one that you can do something about is the one that is called cancer of the cervix, which is actually very common in our environment. Fortunately for us, before you develop cancer of the cervix, for most women, there would have been a flashlight.
What are they?
A warning for you.
What are some of these?
Which is what we call postcoital bleeding. For any woman who sleeps with a man and after rising up, wipes herself to keep herself clean, and
from
she
blood,
see a streak of blood. Do not think it is trauma, that maybe you had a traumatic sex. It is better you see a doctor. You may see it once and it doesn't come back again for the next months. 2, 3, 4 years, and it flashes you again. You don't see it again, and maybe some 5, 6 years again, cervical cancer comes in. And the doctor now asks you, you know, say, yes,
I remember
6 years ago.
Because some people just think it's postcoital abrasion.
Yes. Yeah. So that's a warning sign that you actually need to take care of.
Okay.
Then apart from that, there's a screening for it, which is called the Papa-Nicolau smear. So for every woman of reproductive age, we have said from about 25 years of age, that is sexually active, she'll have a screening from time to time. In some other civilized world, Pap smear is almost as important like your tax receipt that you pay tax. In societies whereby it's the taxpayers' money that is being used to take care of cancers.
Yeah, they want to
do more of preventive health care rather than curative.
Absolutely.
But here, because every man is on his own, you don't find governments, nowadays you find governments doing health outreaches. I would rather expect a government who is doing a health outreach instead of you taking care of lipomas, free eyeglasses. Yes, we should bring in that.
Which is fantastic too.
We should bring in that.
We should. Yeah.
There should be a
maybe it's the fault of you doctors not properly advising people who do some of these campaigns, health campaigns. Because I mean, some of these free surgical interventions have saved a lot of lives. And of course, for our politicians and our leaders, it is what we doctors advise.
Tell them.
So I think
it's a challenge for all of us. Though it has its challenges too, because you know.
Is it very serious? Is it a serious like a surgery or something?
No, it takes less than 5 minutes.
This
to do a screening for a woman. This smear, it takes less than 5 minutes, and it's not painful.
Are you serious?
But the challenge you may have.
Is it very expensive?
Well, in the teaching hospital here, it costs less than 5,000 naira.
This thing we're talking about.
And I don't think that is too expensive for any woman. If it's a test you need to do and you will not do it again until another 3 years. Once every 3 years till you are 65 years of age.
Let me drum this to our viewers at home, especially women. I think we need to do this. Less than 5,000 naira, cervical smear. Abi?
Yes.
Yeah, it's a pap smear. It's something we can do, I think, every year.
Once every 3 years.
Once every 3 years. So it's so cheap. And that's what I'm saying, a lot of ignorance.
Yes, and it goes a long way that if the cancer is picked early, there are measures that can be taken, which is 100% curative. Compared with when you have a full-blown cancer, there's almost nothing we can do about it. Send you for radiotherapy or maybe chemoradiation. And when you do radiotherapy, that has its own side effects also. And at the end of the day, maybe 5-year survival rate, less than 25%. And for our younger ladies also, and I think this should be a concern for families that we should all listen to. Cervical cancer, apart from you can screen to know when you are about to have it before it's there, then there is also vaccination against the organism that causes it, because it's a cancer that an organism has been found, the human papilloma virus, HPV, is associated with it. And girls can be screened again. Even nowadays, in civilized world, they're even talking about screening boys, because vaccinating boys also. Because we know that human papilloma virus exists within the prepuce or in the head of the glands of the man.
Of the man's...
and it doesn't affect the man. But it's the woman that acquires it. It's the woman that introduces it.
Oh, wow.
So the woman acquires it from the man. But if the young girl, 12, 13 years of age, could have been vaccinated against the major strains that causes there is no vaccination for all the strains.
I can see that the people in the developed world value life.
Yeah.
They plan ahead.
So their girls are,
so much
their girls are vaccinated. 12, 13 years of age, you are going to high school, they ask for your vaccination card.
Yes.
For the girl, for the boy, you must have your vaccination card.
I think we may begin to have to do this because we need to
and vaccination also, it's maybe expensive in our society. Maybe now costs roughly about 25,000 naira per vaccination.
Let's even do the
and
smear.
You need 3 shots.
Even the smear, the one that they do every year. Now let's talk a little bit about pregnancies. You know, when people, we've talked about infertility. What makes people to get pregnant and lose it? Get pregnant and lose it. Can you be a spiritual attack or something? No, because at times it becomes, this is another thing if somebody is not getting pregnant. This person keeps getting pregnant, 2-3 months.
There are medical conditions to start with. Medical conditions can be responsible for that. Some have unrecognized diabetes, or they know they have diabetes and they are not managing it well, can cause you to have recurrent miscarriages. Hypertension can cause you to have recurrent miscarriages. And also some other abnormalities of the egg, or even the male sperm, the spermatozoa. Some have, nowadays we talk of DNA fragmentation, something that can cause the woman to have recurrent. So there are issues like that.
Sometimes I heard that even there could be mechanical factors, like
uterine anomalies. If there's issues in the uterus also, that the uterus has 2 bedrooms instead of 1 bedroom, and the pregnancy implants in the smaller room.
So what advice do you have for people who are having this kind of problem?
I think the first thing that everybody needs to do, which we don't normally do in our society and we should campaign for, is what we call the preconception care clinic. Every woman trying to get pregnant should visit the doctor and say, hey doc, I want to get pregnant. And you must be screened for conditions that could affect pregnancy. Or if you have existing medical conditions, maybe we need to do some drug modification for you, or to make sure you have a watertight control of your disease, so that you can have...
Or be able to see whether you have an underlying disease.
So that you can have a beautiful experience in pregnancy. I used to say, pregnancy is not a disease condition. But if you don't manage yourself well, the pregnancy can actually be horrible.
Absolutely. But we have seen where pregnancies at times also can be responsible for some kind of disorders in the body system. This one that makes people's legs swell, high blood pressure moving up.
No, it's not pregnancy. She already had hypertension.
No,
some of them had hypertension. Some who don't have could develop what we call the pregnancy-induced hypertension.
So it's the pregnancy
inducing it. But if you attend your antenatal clinic, I think every woman who is pregnant should visit the antenatal clinic early in the second trimester. And if you're a first-timer, your first time of getting pregnant, you should visit your doctor after your first missed period. At least let's establish the location of the pregnancy and make sure all is well with you. And please keep your antenatal clinic appointment.
How about the use of drugs?
It's a well woman's clinic.
How about the use of drugs in pregnancy?
That also, no woman should use any drug in pregnancy except that authorized by the doctor. Especially in the first 16 weeks of pregnancy. Because it will cause congenital problems.
Having babies that are abnormal.
Babies or babies that will die in the womb due to some organs that have not developed properly, or an early miscarriage based on drugs you have taken. And when you have recurrent miscarriages too, it's not the end of the world. That's the responsibility of the gynecologist to try and walk you up and find out what is causing that. And in as much as the doctor is doing that, I'm not saying you should not pray about it. There's always a rule for prayers. You know, there's this common slogan that the doctor cares, but it's only God that heals. So medicine has also not taken away
that role.
Yes, that role of God. But we have but we also do not advocate for pray
and not
without visiting.
Yeah. Which is responsible for a good number of the mortality we have.
Yeah, so both of them must go all hand in hand, pari passu.
Because I think when people abroad here, we lose women the way we lose here, it hurts them.
Yeah.
And I think it's because they've gone into more of this preventive thing.
Yeah, preventive
rather than
care.
what we do here. Once a woman is pregnant, you don't need to keep her at home and be saying that you're just collecting some drugs somewhere to give her. How about childbirth, the process itself, for a close?
Yeah, I think that's also
process.
I think that also government has a lot of challenge of what to do. Whether we like it or not, the traditional birth attendants are there and they have a role to play. But what we need to do as medical practitioners is not to castigate them, not to try and push them back, but at least open up and let's actually see what they do and where we need to improve on their hygiene, do training and retraining for them also to know what their limitations are, because we must exist together. In some other societies, not every woman delivers in the hospital, but every woman should have a safe delivery.
Absolutely.
There are so many unsafe delivery homes out there.
Do they need to be supervised? Because, you know, for me as a psychiatrist, we've traced a lot of our psychiatric disorders to that simple process. When the baby is coming out, and the brain, even the skull is almost gelatinous, very soft. And when it is mishandled, the implications may not be immediate. It will be several years. And
Even in the hospital. In the Western world, we used to do forceps delivery. But forceps delivery has gone down now.
Yeah, because they saw a lot of associations with mental retardation.
Yeah, even when he's not there, you find a child that is not doing too well in school and is about to get to high school, and you find don't let me say hungry lawyer. I hope lawyers did not hear me. Let's call it a smart lawyer who now decides to say, okay, let's research into your birth history.
Where were you born?
They did a forceps delivery for you. That must be it.
That could have been it.
So that was what affected the intelligence quotient of the child, the IQ. And now that's why you find even in civilized world, more and more doctors running away from obstetrics care and going into gynecology. Because there are so many things about obstetrics now. That's
especially the birth.
Everybody needs that birth process.
I've had
so everybody must have a supervised birth.
So it's safer a woman
supervised birth
is important
in a safe place.
Especially when the labor is obstructed. Viewers at home, when there's difficulty. I mean, our traditional birth attendants are being praised. We have faith birth attendants in some of our churches. Yes, doing good work. But
they must know their limitations.
What are these limitations?
One, they should not attend to first-time pregnancies. that should be left for the hospital. They should not attend to multiple pregnancies once the woman is carrying more than one baby.
Because at any point we may decide to want to do a surgery to bring out the baby.
Complications can come in. They should not attend to any woman who the baby is not having the head as leading. If the baby is coming with the bum or the legs, no, anything could go wrong. And every traditional birth attendant plays faith-based or whatever, or every woman should know that once you are pregnant, at least you must have an ultrasound scan done. At least nowadays, that's readily available.
Like 5,000, 4,000.
That's readily available.
Some of these things are cheap.
Gone are those days that you do not know you are carrying twins until the date of delivery. I can imagine how people felt then. The torture, the anxiety,
when you have
the
to start by two things.
It may first be heralded with joy.
Absolutely.
That wonderful.
But
twins. But a few minutes after, it was done on you.
Of course.
So that means all those things we bought. We need to quickly go and buy a new set. But nowadays, at least the scan is there.
Yeah.
Every woman should have a scan.
Absolutely.
In pregnancy, so that at least you have an idea of.
And there are some baseline tests they do for them in the clinic.
That must be
level, done. This thing that they said people have swollen legs in pregnancy.
Yeah, well, it's not every swollen leg that is bad.
Okay.
It's when your legs are swollen along with elevated blood pressure is what we don't want. But swollen legs, normal blood pressure, shows good perfusion.
Which means when a woman is pregnant that has swollen leg, take her to the doctor. Let them do the blood pressure.
To be able to establish that she does not have elevated blood pressure. And there are women who have elevated blood pressure too and do not have swollen legs. So it's not synonymous. So that means every woman who is pregnant must have a blood pressure check. Before 20 weeks and after 20 weeks of pregnancy.
As simple as that
a blood pressure all must be checked. Because so many women have died in pregnancy due to complications of elevated blood pressure in pregnancy.
How bad is this surgical intervention? Because people ask, how did he deliver? How did your wife deliver? And we have been praying all these years. Why did he have to end up through a surgical intervention? What's your word on that?
I think that's more a cultural or religiosity thing with our society. Then also that natural fear of the knife. Yeah, but I think it's changing now. With the westernized women we have in our society. You have women even coming to the hospital now and tell you, I want an elective CS.
Yes, they want to deliver.
Before that, it was not one of the indications for cesarean section. Absolutely. But now patients wish is an indication.
I want to deliver my baby through surgery.
I want a certain date, a certain time, and a certain doctor to do my C-section. We're getting there also.
And that doesn't take more than 30 minutes, 1 hour.
Yeah.
Because people
it depends on who is doing it and whether it's a first timer or not. But on the average, cesarean section should take 25 minutes to 30 minutes.
Let's even say 1 hour. Because the way people look at it, that how did your wife deliver? They say by surgery. Anyway, we thank God. They look at it like
just that fear. Of willing a woman to theater or anybody to theater and you put her to sleep, that fear of will she wake up. But nowadays, so many surgeries are even being done under regional anesthesia that you don't need to be put to sleep. You are awake, discussing with the doctor, and there's some numbness of the area to be operated upon, and you just feel push and pull without you actually feeling pain. And I think that's good.
Viewers at home, it's been very wonderful discussing with Dr. Oluseye Atanda. He's been discussing about the health concerns of women. And like I said at the beginning, if I leave him, I'm sure we're going to be here for another 24 hours. I will still bring him again for other aspects of the concerns of health of women. So this is not just your first visit on this program. It's been wonderful. I want you to, your last words, what message do you have for women and their husbands too, or the people who are responsible for their health, so that we have a very healthy...
I think the parting word should actually be for all of us. I think let's start with government and health administrators. We must take health of women serious, and things must be done to protect the life of every woman. Remember that statement that says, trained a man,
okay,
you have trained a family also, trained a woman, you have trained
a whole generation,
a whole nation.
Because the woman is the one that rules the world.
So that's how important a woman is. So for the government, we must do more about healthcare of women. And that's why you find some societies, they have special incentives for women, free antenatal care, free delivery. For the family, the husbands, we must be there to support the woman financially, morally, and even go with her to the hospital. And for the woman herself too, your life is your life. You must take care of yourself. Everything should not be my husband, my child. If you die today, someone else will sit in that seat.
Yes.
Please take care of yourself.
Thank you so much, Dr. Attodah. It's been wonderful having you. And
Thank you,
I'm sure we're going to have you again on this program. Yes, we've been on Spring Clinic discussing the health concerns of women. See you this same time next week for another interesting topic. Bye-bye and God bless.